A News Channel 11 investigation revealed a major change to the terms outlined in the merger that created Ballad Health's hospital system 4 years ago.
A change that 3 other medical providers here in our region had no details about until News Channel 11 began asking questions.
Ashley Sharp and digital reporter Jeff Keeling share both sides of this tonight. Ashley joins us in our studio with what this change means for our region. Ashley?
Well, Josh and Sarah, this is a very complicated issue. In simplest terms, this is a disagreement over a major term outlined when Ballad first became a hospital system that has now changed. And it's not very popular with competing medical providers in the region that we spoke with. We're unpacking what exactly is changing and how both sides are responding tonight. When Mountain States Health Alliance and Wellmont Health System merged to create Ballad Health in 2018, it was a move meant to preserve rural health care in the region. The merger created an inpatient monopoly that required state action through what's called a COPA, or a Certificate of Public Advantage. The TOC, or Terms of Certification of that COPA, outline the exact rules as deemed by the state and accepted by Ballad that the hospital system must follow. One of the major terms of the merger, Ballad could not oppose at the state level the creation of a new competing medical facility, like outpatient surgery centers, diagnostic centers, and similar services that require state approval, called a Certificate of Need, or a CON, before opening. Now that's changed. We spoke with Ballad Health CEO Alan Levine.
The Board of Wellmont and Mountain States did not like that provision, but they agreed to it. We have followed this COPA to the word. But there's also provisions that say if something's not working, we have the ability to go ask the state for a change, and it opens up a process of negotiation with the state.
Ballad got a temporary chance to oppose Certificates of Need, or CON, applications when the state suspended that COPA rule during the COVID-19 emergency. With that suspension set to end on July 1st, Levine asked the state for a permanent rule change, which the state granted.
Over the last 2 years, we've had the ability to oppose CONs, and there's been 4 filed. Certificates of Need filed by independent physician groups, and we've only opposed 1.
However, other health service providers like Dr. Jeff Skoondijk of Caring Hearts Cardiology says this represents an overreach of Ballad's power and the terms everyone agreed to at the time of the merger in 2018.
Ballad signed on to it. They agreed to it. Now they are systematically changing the rules, dismantling the COPA such that it has no more teeth.
Skoondijk and Caring Hearts want to open a brand new standalone cardiac procedure lab at their Johnson City clinic.
I can do the same procedure in less time for a significant reduction in cost.
He expects Ballad would oppose their CON application and fears the state will side with the large hospital system.
The connections they have in Nashville and the legal team that they have, it's literally David and Goliath.
Just because we can support or oppose an application doesn't mean that we prevail. It just means we stand in front of an independent government entity that are all appointed by the speakers and the governor, and we make our argument. And then they make the decision. We don't make the decision.
Levine also responding to allegations Ballad is extending its monopoly past inpatient service.
The outpatient market is extremely competitive here, okay? We did not eliminate competition. The only competition that was eliminated was for inpatient beds, which inpatient utilization has been declining for 4 years straight.
And Levine says that decline leaves Ballad needing to protect its interests, that too much competition flooding the market will cause rural hospitals to suffer.
If you have this continue, where people continue to just cherry pick the paying patients and leave the hospitals with no insured patients, you're not going to have hospitals.
2 private medical groups in the region also weighed in. State of Franklin Healthcare Associates and Holston Medical Group, both saying they support Ballad hospitals, but feel they were left in the dark about these changes.
We'd certainly like to know about it and be a part of the discussion anytime there's a change.
Who should get a CON and who shouldn't can be strongly influenced by the hospitals and the power that the hospitals have in the marketplace. So I think there's a lot of reasons why this would have been something that I would have wanted to understand much better before it happened.
Levine says not being able to oppose CONs in the past has already hurt Ballad's bottom line by $14 million a year, something he says could worsen without this change.
Every one of these rural hospitals and some of the non-rural ones that we support financially would die.
But the providers we spoke with believe Ballad can achieve its mission without the state changing the terms of the merger.
They took very specific precautions when they drew the TOC to prevent this very thing from happening. And, you know, it's really time, I think, that the public knows what's going on.